Hello everyone, welcome to my channel. In this video I'm going to talk about homeopathic medicine for the babies, where the babies are really kind of having so great and very good results in the homeopathic medicine. Some people will be thinking that homeopathic medicines are not for the pediatric cases, but it's really a myth. You should not be thinking that, because homeopathic medicine acts wonders in the pediatric cases also. Today I will be talking about one of that wonders also. I had done so much of videos on the homeopathic medicine for baby, and this is one of them also. So myself, Dr. Megha from Yogic Homeo Science. Today I'll be talking about Argentum nitricum. It is one of the silver nitrate medicine which is prepared from. So it mainly acts on the spinal cord, nerves, blood and mucous membranes such as eyes, throat, stomach, urethra, bones, kidney, liver, gastrointestinal tract. Also, it is very suitable remedy for the babies. What are the constitution of the Argentum nitricum? They always look like very thin and whole looking patients. In the babies you can think like the baby is only 2 years old, but the baby will be looking like they are 5 years old, like that. Very irritable and peevish baby is also kind of seen, and it gets irritated or angry very easily. What are the keynote symptoms of the Argentum nitricum? The keynote symptoms of Argentum nitricum is emaciation, progressive emaciation every year, which is most marked in the lower extremities. And defective muscle is also seen, and trembling in the affected parts. You can also see in the Argentum nitricum patient. There is great fear for anything in their life, and whenever they are getting ready to go outside, the diarrhea sets in. After passing the diarrhea, they are feeling all better. Even with the children and even with the baby, the same thing happens. They make him to take bath, they make him to get ready and everything, but he says when they are almost at the door of the entrance, he says the diarrhea is setting in, so I should pass it. After passing it, he is kind of okay. The diarrhea is because of the nervousness which is present all over the drug, because the nervousness is the keynote symptom of the Argentum nitricum. So the patient is really chilly, always uncovered, yet feels kind of wrapped up. Sensation as if there is an splinter in the throat or uterus or other parts of the body. Great longing for the fresh air. There is bleaching accompanies the gastric symptoms. Urine passes consciously daytime and the nighttime. When the bedwetting pediatric patient comes, means they are almost in the first standard or the second standard. They should be already knowing that they should be passing the urine after going to the bathroom, but no, the bedwetting happen. That time you can think of Argentum nitricum. Another wonderful remedy for the bedwetting children is that belladonna. I had given this both remedies, and I had found so much of good results also. And parental training is also required, because the child's is been growing up, so the parents also should be training them, and the medicine also works 50%, and the parent should be also kind of looking for the 50%. Now we will be talking about the baby of the Argentum nitricum. How the baby of Argentum nitricum seriously is. First thing is they are very nervous. Nervousness runs through the whole Argentum nitricum, and this are really appearance is like they are premature aged expression in the face. I already said the baby will be 2 years, but they will be looking like 4 years. There is emaciation all over the body. Very lean thin will be there, but particularly the legs, because the lower extremities are affected in the argentum nitricum. Even in the abrotinum, the lower extremities is being affected. Abrotinum is also given for the children's only, so you should be differentiating between the abrotinum and the argentum nitricum when you are going to really go into, because abrotinum patient are not so nervous as that of argentum nitricum, and diarrhea is not present in the abrotinum, but it is present in the argentum nitricum. But abrotinum, you can see that there is uh, cannabis angus, means they eat so well but they are losing flesh. But in argentum nitricum, they are not even eating well, so they're not even gaining the weight. That is the kind of thing. Whereas the baby craves for sweet. This is kind of particular in the argentum nitricum, which causes diarrhea. There is nervous diarrhea and diarrhea due to gastrointestinal disorder. Due to gastrointestinal disorder, diarrhea is the causation is because of the sugar, candy, sweets, milk, salt, etc. The diarrhea sets in the baby. Nervous diarrhea because they are going outside. That is both kind of differentiation. How the character of the diarrhea is: the green diarrhea, like chopped Spanish of the green watery diarrhea, or turning green when left on the diaper. You can also see these symptoms in the baby of argentum nitricum. This all about the argentum nitricum baby. If you are having any kind of doubts, or if you are confused about this video, you can just comment on the comment section. Babies mental will be like they are very much scared of their schools. They does not want to go to the school, they does not want to write the exams, even they are studying well, but still they does not want to go to the exams, and they does not want to attend any kind of functions with their parents. They're happy, they're healthy in the home, but when going out, no, they are sick like that. And there is frequent loss of memory, and the baby will be repeatedly doing the faults in speech because he cannot find the right things. Means you had said them that H should be coming here, but they forget that H and they write A like that. Means they cannot put the right thing. They know that they should be writing this, but they write the wrong thing. That kind of thing happen. There is so much of mental confusion in the argentum nitricum babies. There's dizziness and tendency for the falling down sideways and everything. There is also vertigo accompanying on closing the eyes or going or exposing to the sunlight. There is great fear of buildings, high buildings and everything, because they feel like that building is going to fall on them. That kind of great fear is there. And the patient always, means the baby always says that the day seems like an year for them. Time passes very slowly. Moving on to the general modalities, that is aggravation and normalization factors of the argentum nitricum. What makes the babies really bad? Cold hair, cold food, eating sugar, sugar candy, ice cream, imaginations or prolonged mental work, warmth in general, lying on the left side, and light or the exposure to the heavy sunlight. What makes the baby better is by open air bathing with cold water, cold application, tight bandage, dark room, and rest. These are all about the argentum nitricum baby. Thank you for watching. Please do like and subscribe. Bye bye.